The Telluride experience began in 2005, when Tim McDonald and I gathered a small group of patient safety leaders in Telluride, Colorado, to talk about creating a patient safety curriculum for resident physicians and health science students. By 2010, we were inviting the students and residents to join the discussions alongside an international faculty composed of physicians, nurses, pharmacists, lawyers, and patient advocates. Our Telluride experience now includes a week-long immersion in patient safety learning, where attendees work side by side with international patient safety leaders and patient advocates. This demand has forced 1 week of learning in Telluride, Colorado, to expand into 8 sessions now offered across the country and across the world.
Every year, the amount of students and residents interested in coming out here has grown. And I feel a lot of times so bad because I review every one of those applications, and for every one we accept, there's 2 to 4 residents and students who would love to come out here.
The Telluride experience to date has really concentrated on relatively young people at the outset of their professional medical training. And so there's a lot for them to learn, but on the other hand, they'll never be more open to learning than they are at this point in their careers.
I was amazed when I came to medical school how behind the medical profession was in the patient safety, risk management, operational risk management.
I think that the reason that Telluride is so valuable, whether it be a medical student, a resident, a nursing student, or a practicing nurse, I think Telluride gives you an opportunity to learn about areas of safety, quality, healthcare, ways of being, ways of working together that you never get in a typical classroom at a medical school or a nursing school. We just don't teach this way.
What David Mayer is doing is training leaders, and especially in understanding how human beings have to have each other in order to be able to give the patient the absolute safest possible care. And that all starts with this type of education, because certainly we're not getting it in most medical schools. That's got to change, but at least this is a forerunner.
I don't want to sound cynical at my early point in my training career, but we have a lot of very enthusiastic first year and second year medical students who look at this stuff and go, how could this happen? And then you have people, even just a few years farther along like me, who see very easily how it could happen and how it does.
And, you know, you've got people who are just starting out as medical students who've never been involved in patient safety before, to people like Lucian Leap, who, you know, founded the field, basically. So to have that kind of cross-generational collaboration is really amazing.
Telluride is vitally putting seeds in all these upcoming doctors. Extremely important seeds before they have become invested in the status quo. The curriculum mix is extraordinarily important to the success of Telluride. So mixing the stories from people who have experienced these things from all sides, those stories are incredibly powerful.
And I think finally bringing in the patient side of it has been a missing piece and is so important, because until you've been on that side of the equation, you don't understand how the patients and families look at this and how that affects us.
In a traditional medical school or a nursing school, there's just no room in the curriculum. So what students find when they come here is a whole different language, a whole different way of being, a whole different way of thinking about their career.
I think it's something that most people don't become aware of until they're further on in their careers, and at that point, you're as ingrained in the culture of medicine as it is today.
Because the problems are not unique, but very often the solutions are. People in their own facility come up with a good idea, we need to share that, and if we leave it bottled up, then we're only going to affect a few people. But if we can spread the message not only across the United States but around the world, we're going to make a huge difference to the quality of care as well as the safety of care.
It was an eye-opening experience for me. I truly got to experience empathy for the first time, I believe, as a healthcare professional. To hear from patients' families and to put yourself in their shoes, it was truly an eye-opening for me.
I think I have unbelievably high hopes. Everyone that is going through this training, we have 80 students, nursing, pharmacy, and medical students. Yesterday we had 17 faculty from every single health sciences college. All of them are joining this global cohort now, and all of them will be asked to make a commitment to seeing this work continue in the same way that Rabal, after he came from Washington, made a commitment to bring it here. So the multiplier effect for what you're creating here is absolutely endless. So what I look forward to is in a couple of years reporting back as to how many million flowers bloom as a result of this experience, because you will see it in nursing, in pharmacy, in clinical care, but I think you will also see it in the curriculum that will be amended here at the local health sciences colleges as a result of both faculty and students recognizing there is a gap and we need to fill it. So the impact will be tremendous, and I think we'll be able to measure that across any number of dimensions.
It's been so exciting to see this vision really take off in the last 5-6 years, not only the expansion in the US, but now to Doha and to Sydney, Australia, where the same vision of educating the young, training the next generation to understand high-quality, low-risk care, to understand why the patient and family's voice is so important into achieving zero preventable harm. All the things we spend 4 days covering, they have believed in it. They want their young learners and their future leaders to be exposed to that same curricula. So it's really exciting to see people embracing what we've been bringing to the U.S. for so many years.
I think it's quite relieving to see that people from all over the world are having the same troubles that we are having here in Australia, and having the same issues with communication, the same issues with open disclosure, and the same issues with sort of informed consent and getting patients involved in their care. And it's quite nice to see that we're not the only one, and we're not the only one dealing with these issues.
The Doctors Company is a sponsor of this program, and they are an insurer of thousands of physicians across the country. You know that there's something up about this group. I don't think they're going to sponsor it if they don't think there's some meat on those bones.
It's been very meaningful for our foundation to be able to sponsor a quality act like Telluride.
My hope is that each of these young people will go back and self-identify or be identified as ownership leaders of patient safety in their institutions. It'll be known that they came to this conference, which is now has legs and is well known around the country. I really think some of them will end up becoming leaders very quickly, both at the medical school level and in a few years at the residency training level. At least that's what we're counting on, and so far I'm starting to see that happen, so I'm very optimistic.
We work together at MedStar Health, have become part of this program and part of the Telluride Patient Safety Summer Camps. And that has allowed us to really expand our mission and really grow us at a pace quicker than I had originally thought we could. So MedStar Health has been a great partner, and I'm just so proud to be working with them in this initiative going forward.
If there's one thing I would leave, this program definitely needs to expand. I think that what the folks with the Telluride Scholarship are doing should be part of every healthcare curriculum in the United States.
I'm very encouraged about this young generation, and that's why we're concentrating on getting them early on in their careers, because they're going to be the change makers that will make a difference. They're intelligent, they're articulate, they're on fire, and we just want to stimulate that fire so that they'll want to make a difference to patient safety. I think patient safety is going to improve enormously in the future. We'll never solve the problem, but these are the people that are going to make it much better and much safer for patients. So that when I go to hospital as a patient, if one of these people is looking after me, I'm going to be much more secure.